everyone, good morning. My name is Renay Bradley, and I'm from the Mental Health Services Oversight and Accountability Commission, and I'm here just to tell you a little bit about the evaluation efforts that we have currently underway over at the OAC. Oops. Okay, so I was told that you are all a fairly sophisticated audience, so I'm just going to give a very brief background. So the Mental Health Services Act is intended to improve the quality of life for Californians living with a mental illness, and I'm going to refer to this as the Act from here on out. And the Mental Health Services Oversight and Accountability Commission, what I'll refer to as the OAC, is here to basically oversee the Act. So how do we go about trying to do that? How do we oversee this Act and the funding that's associated with it? Well, one sort of piece to that is evaluation. So at the OAC, we are very committed to being able to carry out effective evaluation. I've stuck up here a quote from one of the evaluation papers that we've endorsed. Evaluation efforts focusing on outcomes are essential, and I truly believe that. For those of you that don't know, there is actually a statutory mandate for the OAC to conduct evaluations. So luckily for us, every year we actually get a decent amount of funds that we have to, by law, put towards doing evaluations. And with those funds, some of our overarching goals are to do things that lead towards quality improvement in services throughout the state of California. And in addition, and something that's somewhat unique to the OAC, is we want to be able to provide information regarding mental health system performance to the California governor, to the state legislature, clients and family members, and again, the general public throughout the state. So again, these are fairly lofty goals. We want to be able to think about how can we go about doing this. So we do have a little bit of a process in place right now, and I want to quickly review that process with you. So if you are a county and you want funds from the Act, basically you submit your plan to the OAC, and the OAC is responsible for reviewing and hopefully approving those county plans associated with funding requests. And I've listed sort of the 5 major components of services that most counties ask for funds for. In addition to that, we also, again, sort of a more lofty goal, the OAC is responsible for ensuring oversight and accountability of the public community mental health system. And here, it's sort of getting at that broader level of accountability. So when it comes down to it, are the local counties, are the programs and providers actually doing what they're supposed to be doing, and are they using the funds appropriately? So at the county level, counties are responsible for designing, implementing, and hopefully evaluating those services, and then even more hopefully, reporting all the information about their services and the evaluations back to the state. As far as the OAC, our responsibility is then to use the information that we collect from the counties and the local level to really develop this broader statewide picture of what is going on within the Act throughout the state of California. So when I say what is going on, I sort of think about that question within the scope of these 3 primary research questions that the OAC has identified. So one of the questions that we set forth to try to answer within our evaluation efforts is, how has the money been used? And this gets at how many clients are served through those services. We also want to look at what is the impact of those investments on mental health, and this gets at some of the outcomes that actually Gail talked about within the priority indicators. And we also want to look at what could be done to improve the efficacy of those investments. And I'm going to really briefly sort of go through and highlight some of the projects that we've got going on that are beginning to address each of these 3 questions. So the first question, how are funds spent? We have quite a few projects going on with UCLA right now. One is what we call our cost/cost offset project. And for this project, we're just looking at how much it costs to provide clients with services related to full service partnerships. And so we call those FSPs. And FSPs is sort of that whatever it takes approach. So we're just looking at individual counties as well as at the statewide level, what are the costs associated with providing those services, and is there sort of a benefit, is there a cost saving to doing that in the long run? In addition, we're also working with UCLA to look at what we call system-level priority indicators within the community services and support component. So things like demographic profile of those FSP populations and numbers served. We're just trying to get a general picture of what's going on over a few years. And a new project that we've just begun, we're looking at the costs and the numbers served specifically within the prevention and early intervention component. And I know a few other folks are going to talk about PEI later on, so I won't go into much more detail about that. So getting back to that second research question, what about the impact on mental health? And this to me is sort of a big one, the one I think is fairly important. So we've got a lot going on in this question. So again, going back to those priority indicators that Gail spoke of earlier, we are working with UCLA to look at trends over a few years in just what's going on within each of those. So for things like education and employment, housing, homelessness, justice system involvement, and penetration rates. We've just begun, we're doing a participatory research project where we're also looking at the impact of different types of services, including peer support services, employment support services, and crisis intervention services on individual outcomes like employment, housing, and well-being. We've also, again, just begun that early prevention and early intervention program evaluation, and within that, we are asking our contractors to choose a sample of different early intervention programs and look at the different types of evaluations that have been done, and in some cases actually help the counties and help the programs to do evaluations of those early intervention programs so we can begin to get a statewide picture of whether or not those programs are of use. And we've also just begun another project with UC Davis on looking at whether or not the Act has actually helped to reduce disparities. And for that, we're focusing on admissions to new county mental health systems, and we're breaking that down by different demographic profiles like age, race and ethnicity, gender, and maybe a few other things given what's available in the data. So finally, that third research question, how do we improve the efficacy of our investments? So we do have one project, this is with Sac State, where we are trying to address data quality and reporting issues. Also, as Gail mentioned, data quality is a big issue, and we're trying to work to see whether or not we can improve some of the issues that we've seen out there so that we can get more quality information within the data itself and then reported from the counties back to the state. And generally within most of the projects that I've described today, we always ask our evaluators to provide recommendations for gaps in knowledge and limitations of the data systems, and just their overall suggestions for what we can do to provide better quality improvement within the scope of that specific project. All right, so when I look at all of these projects collectively, I try to ask myself, what do these projects provide? And from my perspective, I really think that it's sort of a starting point. They do provide some basic descriptive information about a few of our outcomes. They give us a general understanding of what might be possible to do with the existing data that's out there. They provide templates in some case so that we can obtain consistent measurement and reporting of outcomes. They definitely have highlighted the limitations and the gaps with the existing data systems and reporting systems. And they give us a little bit of insight as far as what is still needed within those same systems. And in some few cases, it does give us a little bit of an understanding of the impact of the Act on outcomes. But we really have a long way to go before we can really answer those three primary research questions and get an idea of what is going on with the Act and is it really doing what we're intending for it to do. So when I think about the question of what is still needed, for me personally, I do think it's a lot of it comes down to the data. Unless we are able to obtain accurate, reliable, timely data, we're really not going to be able to produce good evaluation results or have a good picture of what's going on at the statewide level. So that's something we definitely need. We need more timely data and reporting systems. In order to do that, we need cooperation from all the counties as well as the program and providers within those counties. In some cases, we definitely have a lot of cooperation, but again, there's a big continuum there because I think some counties need support so that they're able to produce better data and reports to us in the long run. And then I also think that the OIC needs cooperation from entities that maintain and house the data. And I'm very open to hearing from folks on the panel as well as you in the audience for ideas and suggestions as far as how we can achieve that level of cooperation, because in the long run, I do think we're all trying to achieve the same thing here, which is to be able to provide quality services to Californians. So thank you, and if you have any comments or questions, feel free to contact me.